Understanding Angelman syndrome, a rare genetic disorder. Angelman syndrome is a rare genetic disorder. It affects the nervous system. This condition is present from birth. However, it is often not diagnosed until later. Angelman syndrome occurs in about 1 in 15,000 live births. The cause of Angelman syndrome is a genetic defect. The defect is on chromosome 15. This chromosome comes from the mother. The defect disrupts the function of a gene called UBE3A. This gene plays a crucial role in brain development. Specifically, it is important for nerve cell communication. When this gene is disrupted, it leads to the various symptoms of Angelman syndrome. Despite the challenges, individuals with Angelman syndrome can lead fulfilling lives. Early intervention and ongoing support are essential for maximizing their potential. Recognizing the signs. Symptoms of Angelman syndrome. Angelman syndrome presents with a range of symptoms. These symptoms typically emerge during infancy or early childhood. One of the most noticeable signs is developmental delay. Children with Angelman syndrome may experience delays in reaching developmental milestones. These milestones include sitting, crawling, and walking. Speech and language development are also significantly affected. Most individuals with the condition have limited or no speech. Another hallmark characteristic is ataxia. Ataxia refers to problems with balance and coordination. This can make walking difficult. Individuals with Angelman syndrome often have a distinctive gait. They may walk with their arms outstretched for balance. In addition to physical symptoms, Angelman syndrome also affects behavior. People with the condition are often happy and excitable. They may display frequent smiling, laughter, and hand flapping. Diagnosis. Unveiling the genetic underpinnings. Diagnosing Angelman syndrome typically involves a combination of approaches. Doctors will begin by taking a detailed medical history. They will inquire about the child's developmental milestones and any concerning symptoms. A physical examination will also be conducted. The doctor will assess the child's muscle tone, reflexes, and coordination. Based on the initial assessment, the physician may suspect Angelman syndrome. To confirm the diagnosis, genetic testing is necessary. The most common test is called a methylation analysis. This test can detect the deletion or mutation in the UBE3A gene. Genetic testing is crucial for providing a definitive diagnosis. It is important to note that Angelman syndrome can sometimes be misdiagnosed. This is because some of its symptoms overlap with other conditions. Therefore, seeking care from a specialist is essential for accurate diagnosis. Section 4. Navigating the journey, treatment and management. Currently, there is no cure for Angelman syndrome. However, various treatment approaches can help manage the symptoms and improve quality of life. Treatment plans are individualized based on the specific needs of each person. One crucial aspect of treatment is early intervention. This involves providing therapies and support services as soon as the diagnosis is made. These interventions aim to address developmental delays and enhance motor skills. Physical therapy, for example, can help improve muscle strength, balance, and coordination. Occupational therapy focuses on developing fine motor skills and adaptive strategies for daily tasks. Speech therapy can assist with communication even if verbal communication is limited. In addition to therapies, medications may be prescribed to manage specific symptoms. For instance, anti-seizure medications can help control seizures, which are common in Angelman syndrome. Medications for sleep disturbances or behavioral issues may also be considered. Section 5. Stories of strength living with Angelman syndrome. Behind the medical diagnosis of Angelman syndrome are countless individuals living full and meaningful lives. Their stories highlight the resilience of the human spirit and the power of love and support. Take, for example, the story of Amelia. Diagnosed with Angelman syndrome as a toddler, Amelia's parents were initially devastated. However, they quickly embraced their daughter's unique abilities and focused on providing her with every opportunity to thrive. Through years of therapy and unwavering support, Amelia defied expectations. She learned to communicate using sign language and assistive technology. She developed a passion for music and art, finding joy in expressing herself creatively. Amelia's story is a testament to the potential that exists within every individual with Angelman syndrome. Countless other stories illustrate the triumphs and challenges of living with this condition. These stories serve as a source of inspiration for families, educators, and healthcare providers alike. Section 6. A beacon of hope. Research, support, and the future. The future for individuals with Angelman syndrome is filled with hope. Ongoing research continues to unravel the complexities of the condition, paving the way for potential treatments and even a cure. Scientists are exploring gene therapy approaches that aim to replace or repair the faulty UBE3A gene. Clinical trials are underway to evaluate the safety and efficacy of these promising therapies. In addition to scientific advancements, a strong network of support exists for individuals with Angelman syndrome and their families. Organizations like the Angelman Syndrome Foundation provide valuable resources, connect families with one another, and advocate for increased awareness and research funding. With continued research, improved treatment options, and unwavering support, the future for individuals with Angelman syndrome is bright. Their resilience, coupled with the dedication of researchers and caregivers, offers hope for a brighter tomorrow.